All right, so cool. We are moving to the next route of drug administration. This is what is known as the ophthalmic, or you can also say the eye route of drug administration. So you are giving drug to a patient, but you are basically giving this drug directly into the eye. Now, ophthalmic route is like an overview because there are various places, up to 10 places in the eye where you might actually give a drug, So later on we'll talk about each of those places: subretinal, subchoroidal, and the systemic route too. So ophthalmic, you say there are different places. So for ophthalmic, we say that ophthalmic route of drug administration involves delivering medications directly to the eye for local treatment of ocular conditions, like we're talking about glaucoma, So most of the times, this type of medication now is now limited to what? It will be more effective when you are treating eye-related conditions. So that should be one of the disadvantages, All right, so for what we got, we said that it's mostly used when you want to deliver medications directly to the eye for local treatment of conditions like glaucoma, maybe infections in the eye, all right, maybe inflammation in the eye, maybe somebody has some dry eyes conditions. So types of ophthalmic delivery, like I told you guys, is different types. It can be topical, where you are dropping the medications directly on the eye. All right, so topical is mainly for eye drops and ointments. All right, so it's the most common methods. However, it's the most common method, So mostly used to also deliver antibiotics, or you want to lubricate the eye, or some anti-inflammatory drugs. So there's limited bioavailability due to rapid drainage via the nasolacrimal duct. Alright, so we also have the periocular administration, where you can give the drug subconjunctiva, just below the conjunctiva, or you give it retrobulbar, this is at the back. Alright, at the back, So it's used for what? These ones are mainly used for long-acting steroids and aesthetics, when you want to numb the eye for some eye procedures. This can bypass the corneal barriers, allowing for better drug penetration. So that one, you are giving it inside, you basically use injections. Yeah. So intravitreal now. Intravitreal, just like we have on this slide, can you see? Inside the vitreous humor. So deep down, you use an injection too. So used for retinal disease like macular degeneration, diabetic retinopathy, provides direct drug delivery to the vitreous humor. Then systemic administration, that's like you're basically giving drug right to the retinal artery, so that it takes it to the retinal vein to take it to the whole body, So it's used for severe infections or inflammatory conditions. All right, so there's limited ocular penetration due to blood ocular barriers. Advantages of the ophthalmic routes, right, in as much as we looked at it roughly, is if you want to deal with eye problems, you deliver it directly, So there's rapid onset of action for conditions like glaucoma and infections. There's controlled drug release with implants and injection. Disadvantages is there's low bioavailability for topical drugs. Frequent dosing is required, because the drainage is so fast, It requires invasive procedures. If you want to give the drug deep inside, you have to use injections, which requires only professionals to actually do that. It's not a method of drug administration that I can say that the patient should go and be doing it by themselves, So it requires steady monitoring and all of that. So that's it for ophthalmic routes of drug administration.